Bonjour, good day. I'm joined here today with three leaders representing thousands of healthcare workers. Michael Hurley is the president of the Ontario Council of Hospital Unions. Angela Preocanin, first vice president of the Ontario Nurses Association, and JP Hornick, the president of Ontario Public Service Employees Union. We all share a vision for healthcare that is there for people when they need it, that's ready for people if they ever fall in that position, that no one should have to wait in pain because there's not enough healthcare workers, that the size of your wallet or how much money you earn should not determine the quality or the speed at which you receive healthcare. Sadly, we know that's not the case right now with Prime Minister Trudeau. Right now, the reality is we're seeing things getting worse and worse. We have seen that people are waiting for hours and hours in emergency rooms, sometimes days. We know that people are waiting in pain for important surgeries. And we know that healthcare workers are burnt out and exhausted. We're not surprised that in response to this serious crisis that the Conservatives are leaning into and celebrating a solution that involves for-profit privatized care. That's in their playbook. That's what they've always wanted. But we are surprised that the Prime Minister is now calling privatization innovation, when not too long ago he was very critical of the for-profit private solution as something that would hurt our healthcare and hurt people. Now, we have a decision in front of us, and we're putting a choice in front of Prime Minister Trudeau. He can choose to invest in the public universal healthcare system and hire more healthcare workers, or he can choose to go down the path of private for-profit care, which will only make things worse. We believe that we need to rebuild our healthcare system, and that means investing in the workers, investing in the frontline workers to make sure people get the best care possible. For the upcoming discussions with the premiers, our priority is that any agreement that does not include clear commitments to hire more frontline healthcare workers would be a failure, and that what we need to happen right now are investments to save our healthcare system, to hire more frontline healthcare workers. Ottawa needs to urgently partner with provinces to retain, to recruit, to train, and to respect healthcare workers. That is something that can be done and needs to be done. Donc aujourd'hui, je veux remercier la participation des chefs des syndicats qui représentent des milliers de travailleurs de santé. Aujourd'hui, on a avec nous Michael Hurley, président Conseil des syndicats d'hôpitaux de l'Ontario. Angela Preocanin, première vice-présidente, Association des infirmières et infirmiers de l'Ontario. Et JP Hornick, président du syndicat des employés de la fonction publique de l'Ontario. Et nous partageons une vision de notre système de santé, un système qui est là pour vous quand vous avez besoin, un système qui ne répond pas aux besoins des gens, et un système qui est prêt quand vous avez besoin, où personne ne devrait être obligé d'attendre dans la douleur pour recevoir les services. Finalement, un système qui ne dépend pas sur combien vous gagnez comme salaire ou combien d'argent vous avez dans la banque, que tout le monde peut avoir accès aux des services de qualité. Mais malheureusement, on sait que ce n'est pas le cas maintenant. Avec Prime Minister Trudeau, les choses ont empiré. Maintenant, les listes d'attente dans les centres d'urgence sont trop longues. Ça prend des heures et des heures et des temps, un jour pour recevoir les services. Des gens attendent dans la douleur pour recevoir les opérations. Et on a des travailleurs et travailleuses de la santé qui sont épuisés. C'est vraiment une crise de système de santé. Ce n'est pas surprenant pour que les conservateurs, et Pierre Poilievre, évidemment incluant, sont applaudis. Ils applaudissent la privatisation à but lucratif des soins de santé comme solution pour régler les crises. On sait que ça ne va pas régler les crises, mais ce n'est pas surprenant que c'est ce que les conservateurs proposent ou ils applaudissent cette décision. Mais on est surpris que le Premier ministre Trudeau applaudit cette privatisation parce qu'il a critiqué cette même approche il y a 2 ans. Maintenant, il appelle la privatisation l'innovation. Et c'est la mauvaise chose à faire. Parce qu'on sait que ça ne répond pas au problème. Ça ne règle pas le problème de notre système de santé. Parce que le problème de notre système de santé, c'est un manque de travail de santé. Donc, Justin Trudeau a un choix aujourd'hui. Est-ce qu'il va investir dans notre système de santé public et embaucher plus de travailleurs de santé, ou est-ce qu'il va continuer de laisser les provinces ou d'investir dans la solution de privatisation à but lucratif? On dit que maintenant, on a un choix comme pays. Si on veut défendre notre système de santé publique, on doit investir et on doit embaucher plus de travailleurs. Donc, on présente cette solution au Premier ministre. Vous pouvez investir dans le système public, embaucher plus de travailleurs, régler les crises, ou investir dans le système de privatisation à but lucratif et empirer les choses. On pense que Ottawa doit travailler et collaborer à toute urgence avec les provinces pour régler ces crises. Ça veut dire aider comme un vrai partenaire pour embaucher plus de travailleurs de santé. C'est quelque chose qu'on peut faire et on exige le gouvernement de le faire. Now, I'd like to introduce Michael Hurley, President of the Ontario Council of Hospital Unions, to share his perspective. And again, I want to thank him for being here. Michael.
Thank you very much. Good morning. Death rates in private hospitals and private clinics are higher on average by 2% than their public counterparts. Outcomes are less successful. Costs are higher. Over 30% higher for the 5,000 cataracts, which were announced as awarded to Herzing Corporation here in Ottawa just last week. Private clinics and hospitals bleed staff from public hospitals. 37,000 positions out of 260,000 positions in Ontario hospitals are currently unfilled, and the annual attrition rate of 15% a year adds tens of thousands of additional vacancies. This personnel crisis has driven the closure of over 100 emergency departments over the summer and fall in Ontario, as well as the closure of other programs and the cancellation of surgeries. But commercializing hospital surgeries and diagnostic procedures is a top priority for the Ford government, and sadly, this is happening with the tacit support of the Trudeau government. It is in this context that the deliberate understaffing in our hospitals, the degraded compensation for the workforce, the impossible workloads in Ontario hospitals should be viewed. We know that the Ford government is using the current weakness of the public hospital system against it to privatize a backlog of surgeries and diagnostic services. We know that the federal Liberal government is anxious to be seen to be actively supporting hospitals, which are in crisis across the country. But the federal government's requirement of Ontario to collect data is cynically politically expedient. It won't stop the bleeding out of scarce healthcare workers, and it isn't efficient cost-wise, but it certainly gives the appearance of action. We know that privatization can be a road from which there may be no turning back. If the Ford government believed it had the support of Ontarians, it would not have announced privatization plans in the summer months. It is afraid of a fight on this issue. People in Ontario are committed to defend publicly delivered health care and will give them that fight and continue it until the end of the next election and beyond, until we wear them down and wear them out. We have the capacity to do that. The Trudeau government stands at a crossroads and needs to decide where it stands on this issue of privately delivered care. Today, we call on the Prime Minister to come down solidly on the side of not-for-profit delivery of hospital services and to make this a requirement for additional federal funding. Thank you.
Thank you so much, Michael. Now I'd like to ask Angela Preocanin, the first Vice President of the Nurses Union of Ontario, to share her experiences and her thoughts as well. Thank you so much.
Hello, everyone. My name is Angela Preocanin, and I'm a proud RN and the first Vice President of the Ontario Nurses Association. ONA represents 68,000 nurses and healthcare professionals across the province, including 18,000 nursing students. I want to thank Jagmeet Singh for having invited us here today for your steadfast support of our public healthcare system and the nurses and healthcare professionals that work day in, day out providing care. We are at a critical moment for public healthcare in Ontario and in Canada. ONA is proud to stand with fellow healthcare professionals today, calling on Prime Minister Trudeau to keep Canada's healthcare public. As the Prime Minister prepares to meet with the premiers to discuss healthcare, we are calling on Mr. Trudeau to require that federal healthcare transfers to the provinces must be invested in public, not-for-profit delivery. This is essential to ensure that the staffing and care crisis in our public healthcare system does not get worse. We cannot allow for for-profit companies to poach nurses and healthcare professionals from our public hospitals. To truly improve public healthcare, the federal government must increase federal transfer funding with the right conditions in place to ensure that funding goes towards increased staffing, improving patient care, and not padding corporate pockets. That means enforcing the Canada Health Act and requiring provinces to implement a comprehensive strategy to retain and recruit all nurses and healthcare professionals into our public healthcare system. In Ontario, Premier Ford seems determined to privatize healthcare system and to let private companies profit for healthcare. We can't let this happen. The Ontario's public healthcare system is not Doug Ford's or any premier's to dismantle and to sell off to their corporate buddies. Our public healthcare system has been built up over generations and belongs to all of us. The Ontario Nurses Association is working hard, hand in hand with our allies in the labour movement, and we're calling to the federal government to use its power to preserve and protect our public healthcare system and to stop this dangerous plan to privatize healthcare, hospital care, and by imposing on the transfer of federal healthcare funding. Thank you.
Thank you, Angela. I really appreciate your words. Now I would like to introduce JP Hornick, the President of Ontario Public Service Employees Union, to share some words as well. Thank you so much. Thank you.
Good morning, everyone. I'm JP Hornick, President of the Ontario Public Service Employees Union, and I'm here on behalf of OPSU-SEFPO's 180,000 members across Ontario, and the 60,000 of whom are working in Ontario's public healthcare system, a system which the Ontario government has been actively underfunding and draining of staffing in order to justify its clear privatization agenda. Ontario's healthcare crisis has been manufactured to allow our public system to fail. We can do better, but privatization isn't the answer. It will not solve the healthcare crisis. It won't solve the staffing crisis. It will make healthcare less accessible and less affordable. It will pull staff and funding away from the public healthcare system. It will worsen wait times. Upselling at private facilities will mean higher costs and less access for those who can't afford to pay. The formula is not new. Create a crisis, then privatize. The formula to create a crisis in the public service is to starve it of funding, worsen working conditions by doing things like deliberately reducing staff levels, by restraining wages, by driving people out deliberately, and then offer private clinics as the only possible solution. We have seen this before, but we know that with political will, at meetings like the one taking place right now between Prime Minister Trudeau and the health ministers tomorrow, many of these problems can be fixed. As a matter of fact, they must be fixed. Keeping healthcare public must be the goal, not just one in a series of options, because it is central to the profoundly important principles of equality and accessibility that we base our Canadian identities on. It ensures that everyone, no matter what their income status, gets equal high-quality access to care. That commitment to equality is what makes public systems better than any other, and it is worth fighting for. There's absolutely no doubt that more healthcare funding is needed in Ontario. We need the federal government to pay its fair share, and we need them to protect our public healthcare system in the process. After all, the Canada Health Act is federal legislation. New funding must come with conditions, along with full transparency and accountability. It must come with guardrails to protect the public not-for-profit system, to ensure that provinces actually put that funding into public frontline care, into staffing, into supporting workers on the front lines, not into shareholder profits. Canadians are struggling to make ends meet right now, and we can't afford additional medical costs that could tip us into bankruptcy. Like many of our neighbors just to the south, enough is enough. Many Canadians assume that universal public health care will always be there, but it won't be unless all levels of government take action now. We will organize, we will fight, and we will win against the privatization agenda. And so, Prime Minister Trudeau, it's time to do your part and protect public health care. Thank you.
A huge thank you to each of our speakers. They really raised the issue of defending our public, not-for-profit system and the harms of the privatization schemes and how that will only make things worse. Again, a huge thank you. Un grand merci pour votre participation aujourd'hui. Maintenant, je suis prêt pour des questions. Right now, we're ready for any questions you might have.
Monsieur Singh, je veux bien comprendre, est-ce que donc cette entente-là avec les provinces doit être conditionnelle à ce que ces provinces-là n'aient pas recours au système privé? Vous, comme gouvernement, vous metteriez là, en place cette condition-là au transfert?
Dans notre avis, le gouvernement fédéral doit s'assurer que l'argent public va dans notre système public. Ça veut dire qu'on investit dans le système public, mais aussi pour régler la crise. Et la crise, c'est un manque des travailleurs de santé. Donc, c'est un principe, oui, de défendre le système public, mais c'est aussi efficace parce que la solution, c'est embaucher plus de travailleurs. Avec la privatisation à but lucratif, il n'y a aucune garantie que ça va augmenter les nombres de travailleurs. Effectivement, l'opposé va arriver. On va cannibaliser les travailleurs dans le système public. Donc, ça va empirer les choses. Donc, c'est exactement l'opposé de ce qu'on doit faire.
Donc, est-ce qu'il faut pénaliser des provinces comme l'Ontario qui ont recours déjà au système privé dans leur offre de soins?
C'est maintenant le moment quand on est dans les négociations de négocier une entente où c'est les conditions de cette entente. Donc, maintenant, dans les négociations, quand le Premier ministre rencontre les Premiers ministres des provinces, il doit dire que on va être un vrai partenaire. On est prêt de travailler ensemble. On doit travailler ensemble parce que depuis longtemps, les conservateurs et les libéraux au niveau fédéral ont coupé les investissements dans les soins de santé. Donc, on doit réinvestir plus d'argent, être un vrai partenaire, mais aussi, on doit s'assurer que l'argent public règle le problème. Donc, ça veut dire l'argent public au niveau fédéral embauche les travailleurs, les médecins, les infirmiers, les travailleurs de santé.
Can I just get clarification on your stance in English?
Sure.
Are you saying no public funding towards private care, or are you saying there should be stipulations attached to public funding to eliminate private care in provinces? Can I just get your clarification?
Sure, yeah. Right now, we're up against a healthcare crisis. We're saying the public money that we use at the federal level should not be going to for-profit care. And while there's a negotiation happening right now, the Prime Minister has an opportunity to say, we will not be spending public money to invest in a for-profit delivery of care, particularly when the crisis that we're up against is a crisis of a shortage of healthcare workers. And putting money into a for-profit, privatized delivery of care will in no way solve the problem. And in fact, it will only make it worse because the only way they can staff the for-profit clinics is to cannibalize or poach, as was said earlier, the workers in the public system. That in no way is going to help people who are dealing with long wait times in the ER. That is in no way going to help children who are struggling to get care at children's hospitals. So the proposal we have is based on principle, but also based on the reality of the problem that we're up against is a problem of a shortage of workers. So the federal government should not be putting any money to provinces that go towards for-profit delivery, and that money should go towards the solution, which is hiring more workers.
But Mr. Singh, that the Canada Health Act does not actually say that using a private clinic that's publicly funded in which the user, the individual patient does not have to pay is illegal. the federal government actually has no way of stopping that. It's part of the Canada Health Act. It's how it was conceived. Doctors technically are private practitioners in Ontario, for example. In BC, you're focusing on Doug Ford, but in BC, the NDP premier there has acknowledged they also use private delivery within a public system and that it's helping their system. So I don't understand why you're focusing on this rather than on the overall goal.
Let's just take the BC example. BC has acknowledged that they have, there exists private for-profit delivery of care, but what they're actually doing is going the opposite direction. They're actually purchasing for-profit clinics and bringing them into the public system. They've actually taken workers that were kicked out of the public system under the previous government and brought them back into the public system. The direction that BC NDP is going is great evidence where we all should be going, into hiring more public workers and to shifting away from the for-profit delivery into profit and into public delivery. So that's one. So the BC NDP is a great example. They're actually acknowledging that the past was a wrong decision and they're moving in the right direction, which is to include more public delivery and own or purchase back those private clinics. And in terms of what the federal government can do right now, we're in the midst of a negotiation. The negotiation is the opportunity to say, yes, we will deliver this money, if that money goes towards public delivery of care and particularly goes towards solving the problem. The problem that we're up against is one of not enough healthcare workers. So use the negotiations that we have right now to ensure that money goes towards solving the problem. And so we're talking about using the opportunity right now to meet with the premiers to say we will deliver money if that money goes towards solving the problem, hiring more nurses, hiring more doctors, hiring more healthcare workers. That's what we should be doing. Negotiating right now to solve the problem, not giving money to provinces to allow them to privatize care and have more money of our public money going towards profiting for-profit clinics. Very different from fee-for-service for a physician. We're talking about for-profit clinics. That should not be something that the public should be financing. What we should be financing is hiring more nurses, doctors, and frontline workers.
To be clear then, are you saying that as part of these negotiations, the federal government should require all provinces to do as BC did and buy back all of those private clinics and bring them back into the public system? Is that what you're saying?
So I'm saying that what BC NDP has done is the right thing. They're moving in the right direction. But what I'm saying that the federal government has to do right now is hire more nurses, doctors, frontline healthcare workers.
Hire anybody. They send money to the provinces.
What the federal government should do is to negotiate with provinces, say the problem that we're up against is a shortage of healthcare workers. We need to invest in hiring more healthcare workers. If you want the federal government to be a partner, we will be a partner. We need conditions or guarantees that the public money we spend actually goes towards hiring frontline healthcare workers. That's exactly what we can do in a negotiation. You talk about the conditions of the money. The Prime Minister was very strong on this. He said there's going to be conditions. I absolutely agree there should be conditions. Those conditions should be public money should solve the problem. Public money shouldn't go towards making a rich corporation richer. Public money shouldn't go towards a for-profit clinic being able to have more profit. Our public money should go towards solving the actual problem that we're up against, which is a shortage of healthcare workers. So the federal government should be a partner in solving that problem, working with provinces, delivering the funding to solve that problem, working in terms of immigration solutions, looking at national licensing solutions, but using our public money to actually solve the problem, which is hiring more workers.
Why does this matter to patients? I mean, if in Ontario, Doug Ford keeps saying you're not going to pay with your Visa card, you're going to pay with your OHIP card. So what does it matter to a patient, whether they're going to a public clinic or a private clinic, if they're getting the same service?
So we think about that parent that had to wait in the children's hospital for hours and hours while their kid couldn't breathe. For that parent, Doug Ford's quote-unquote solution will not make that wait time any less. That child will still have to wait for hours and hours, struggling to breathe because there's not enough frontline healthcare workers at the children's hospital. For someone who goes into an emergency room and has to wait 12, 15, 16, a full day of wait to get care in an emergency room and are worried right now. I've met people who are worried about doing activities because they think if I get hurt, I don't know what's going to happen if I go to an emergency room. For that person who's worried about getting care, or those people that are waiting for emergency services for hours and hours, Doug Ford's solution, quote unquote solution, is not going to actually make anything better. And in fact, concretely, it will make things worse. Because where are those nurses going to come from? Where are those frontline healthcare workers going to come from? If there's a massive increase in for-profit delivery, they have to come from somewhere. They'll be pulled out of the public system. So you'll have emergency room nurses pulled out of the emergency rooms. You'll have frontline workers in children's hospitals pulled out of those positions into the for-profit private clinics, and it'll no way make those conditions better. It'll in fact make those worse. So all those parents worried about their kids, all those people worried about getting care in emergency rooms will have a worse outcome. Things will get worse for them. And so that's why it matters to patients. They want to see things get better. They want to be able to see a healthcare system that's there for them when they need it. And the solution is not going to happen from a for-profit delivery. It's going to happen if we had enough nurses, doctors, frontline healthcare workers to meet the needs of people. And that's what we need to do.
Mais à court terme, M. Singh, vous ne pensez pas que le patient, ça ne le dérange pas bien de voir un médecin au privé ou un médecin du public en autant qu'il ne paie pas? Le patient, ce qu'il veut actuellement, c'est voir un médecin. Quel est le problème actuellement à ce système-là, puisque le patient ne paie pas là, au bout de la ligne?
Je commence avec c'est quoi le problème en général, et puis je touche cette question de le patient ne paie pas. Donc, le problème en général, c'est si on parle de centre d'urgence, une grande liste d'attente, une liste d'attente qui est trop longue. Si on parle en général, les hôpitaux pour les enfants, les problèmes dans notre système de santé, ce n'est pas seulement une question d'opération, c'est les listes d'attente dans les centres d'urgence pour les enfants, pour les gens en général. La proposition, je ne veux pas utiliser le mot solution, donc je vais dire la proposition de mettre plus d'argent dans un système privé à but lucratif va empirer tout ça parce que ça va cannibaliser ces travailleurs qui travaillent dans le système public. Donc, s'il y a déjà un manque de travail dans le système public, dans les hôpitaux d'enfants, s'il y a déjà une pénurie de travailleurs de santé, ça va être pire encore si on cannibalise ces travailleurs et puis les embauche dans un système de privé. Donc, ça ne règle pas le problème, ça va empirer le problème. Si on parle des patients qui reçoivent les services privés à but lucratif, la vérificatrice générale de l'Ontario a dit que même si le gouvernement dit que les patients ne payent pas, ce n'est pas le cas. Souvent, dans les cliniques comme ça, les cliniques à but lucratif, les travailleurs vendent des services additionnels et les patients ne savent pas exactement ce qu'ils doivent faire. Et le résultat, par rapport à la vérificatrice générale de l'Ontario, les patients payent quand ils assistent les cliniques à but lucratif privées. Donc, ce n'est pas le cas qu'ils ne vont pas payer. C'est une menace aussi qu'ils vont payer. Donc, dans les deux cas, c'est un problème. C'est pourquoi on dit qu'on a déjà un système public, un système public qui n'a pas les financements nécessaires pour livrer les services. Donc, bien financer le système qui existe au lieu de bâtir un système complètement nouveau.
Mr. Singh, zooming out a little bit, the premiers are demanding a 35% increase immediately, or sorry, an increase to a 35% cost share immediately, so that's $28 billion annually, plus a 5% annual increase on top of that. Does the NDP support that demand, or what is the level at which the NDP believes the Canada Health Transfer should sit at?
We ran in the last campaign in 2021 that we would like to see the federal portion return to 50-50. And so that's what we believe. Now, we acknowledge that that's something that can happen overnight, but we need a plan to get to that. And what we're looking for is a plan to get us back to being a real partner for healthcare delivery, acknowledging that's not something that can be done overnight. That's not something that can be done in one budget, but that's what we want to achieve again. We want to achieve a balance where the federal government returns to being a real partner in delivering healthcare so we can properly fund our healthcare system, make sure we've got the sufficient numbers of healthcare workers to respond to the needs of people, and make sure people can get the care they need when they need it. So that's our vision. So our vision is that we need to move there quickly. We need to do that prudently and responsibly, and we'll work with provinces. When I'm Prime Minister, that's something that I would focus on, getting to that point in a prudent and quick manner.
Where do you think federal spending or federal contributions to healthcare stand at this point? I know the provinces say it's 22%, the feds say it's closer to a third. Where do you think it is?
I support the notion that, well, first of all, it's way less than it should be. I think we can start with that. And it's far less than what it used to be. There used to be a much more of a balance. So I think those are two things we can acknowledge, and that Conservatives and Liberals both cut that contribution. Most recently, Harper had a massive cut to it that Prime Minister Trudeau continued. So I think those are all things we can agree with. In terms of the exact number, I've said the 22% number, that's what the federal portion is at. Either way, it's significantly reduced and it needs to be increased.
But to Tom's point, the federal government's in part reduced its 22% share because they transferred tax points in the 70s, and that's why the feds actually say that it's closer to 35% or 40. So just when you're talking about doing equal share, so 50-50 between the feds and the provinces, what is your baseline? Because that obviously dramatically changes how much more money you believe should be put into the system from the federal government.
Well, fundamentally, we come down to the question of what does it mean to be a real partner? And overall, if we take a step back, it's clear the federal government hasn't been a real partner for decades. They've been reducing their contribution. They've been playing less and less of a role, and that's a problem. And we need to see that increased. We want to see the federal government's contribution increase. And under a new Democrat government, that's exactly what we do.
And going back to your point on that, expanding private care within a public system cannibalizes the human resources in the public system. How do you square that argument with the fact that you're saying your whole argument overall is that the government should be forcing provinces to hire more staff? Where are those staff coming from? Are they being canalized from the private system, or in one of your things are you saying there are staff available, and in another one are you saying there aren't staff available?
No, the staff's not available. So the emphasis that we need to focus on is the three things that a lot of healthcare workers and professionals talk about. We need to retain the workers we have, we need to recruit more workers, and we need to train more workers. And some of the solutions being proposed would be to put emphasis around more spaces for training. That's more of a long-term solution, of course. That's not going to happen overnight, but we do need to train more workers in Canada. We also can look at, and what's been proposed as a solution, is putting more resources towards ensuring that those who have international training, and there's thousands and thousands of Canadians with international training in healthcare that aren't working in their field for a number of reasons. The barriers to getting qualified are too high. The process is too complicated. So putting emphasis towards that and then hiring those workers once they qualify. There's also immigration barriers. I did a press conference with a number of frontline healthcare workers, specifically nurses, that were internationally trained, actually got their qualifications in Canada, but because of an immigration barrier, weren't able to practice in Canada. So there's a number of examples where we can increase the number of healthcare workers, but that's got to be the solution. And not that it's easy to do, but if the crisis we're up against by all the experts is that there's simply not enough healthcare workers. There's not enough nurses. There's not enough healthcare workers in general, personal support workers, care workers. There's not enough physicians. That's the problem. The solution has to be to increase the number. And that's where the emphasis should be going. That's where the resources should be going. That's where the time and the strategy should be going. How do we hire more workers to deal with the needs of Canadians?
Can I just get you on pharmacare? It's part of your deal with the Liberals. Yeah. When should we expect a bill to be tabled?
So in our agreement, it is by the end of the year, and we didn't stipulate a specific month, but it is by the end of the year that the Canada Pharmacare Act, or the legal framework to move forward with pharmacare, should be tabled and passed by the end of this year.
Doesn't that need to start soon? I mean, the legislative process doesn't happen in a day, right? So
yeah, we haven't laid out in terms of what month. We just laid out a deadline. Similar to our dental care program, we said it has to happen by the end of the year, and we were able to achieve that for children under 12. That happened by the end of the year. So similarly, in this agreement, we have a number of things that have to be done by the end of this year, and one of them is a legal framework for pharmacare.
I was asking about your dental care agreement, and that through that, you're transferring public funds to private providers who are dentists. So I'm just sort of wondering philosophically why you're okay with that, but you're not okay with private providers in the healthcare system.
Yeah, it's a different scenario entirely. We've got a public system already when it comes to hospitals and healthcare delivery. In the dental delivery, there is no public system, so we're not cannibalizing from a public system. There is no public system. And our view is ultimately with dental care, we want to roll it into the public system. But right now, there's millions of Canadians that have no coverage whatsoever. They have no access to dental care, and we want to give those Canadians access. So by the end of this year, seniors, teenagers, 18 and under, and people living with disabilities will have access to a federal program to look after their teeth. Ultimately, a new Democrat government would roll dental care into a public system, but there is no public system right now. When it comes to healthcare, though, there is a public system, and that public system has been starved. And so we think it's absolutely the wrong thing to do to invest in a parallel for-profit system when that in no way is going to solve the actual problem of a shortage of healthcare workers.
Can I just go back to the BC? I'm just a bit confused why you're spending so much time focusing and attacking Doug Ford when your own party, which runs the government at BC, is defending private healthcare within the public system. I know that they did buy back some of the clinics that were privatized, but Adrian Dix this past year defended the use. He said that having a small number of surgeries that increase our capacity, as long as there's no extra billing and they follow the Medicare Protection Act, I don't have any objection to that. So can you explain to me if you are okay, if you agree with Adrian Dix?
The fact that there is private delivery that exists, yes, it exists. But we look at the direction that the province is headed. The province is clearly heading in a direction where they think that it is much better to put those services into the public system. I've actually spoken with the health minister, and he says, yes, it would be much better if those services were actually included in the public system, and that's why we're buying them up. It's much better. It's better delivery, less cost. We get more patients that get care, better quality of care. So they're moving in the direction that we think that the whole country should move in, that care should be delivered in a public way. And that's why the province is spending money to buy up for-profit clinics, bring them into the public system, because it's better for healthcare delivery. We agree. The fact that they exist now, that's something that previous governments have allowed to happen, the wrong decision, I would say. And now what we need to do is build a system that we want for the future. Do we want a system where we have more and more for-profit private delivery, which we know will cost more, we know the quality will go down, and we've seen that very clearly when there's for-profit delivery of healthcare, corners are cut to make that buffer for profit. We saw that in the long-term care homes, where the worst conditions of care were in the for-profit homes because care hours were cut, because staffing levels were cut, and as a result, people had horrible results. We saw horrific examples.
Care. He actually says it improved the system's capacity to deliver.
What he's also said very clearly is that we need to bring it into the public system, and that's why they're purchasing them, because it's better when it's in the public system. And the fact that there's some that exist privately is a fact. That's true. Governments have made that decision. What the New Democrats are doing in BC is saying that that was a bad decision. We're going to actually buy them back and bring them back into the public system because it's better for people, which we agree. And right now, either way, what we're up against is a healthcare worker shortage. There is no way anyone can justify how investing in a parallel private for-profit system will in any way deal with a healthcare worker shortage. It will not. So that is not going to help a kid at a children's hospital that has to wait for hours and hours. It's not going to help anyone that's waiting for hours and hours at the emergency room. It's not going to help people get access to a family physician when they can't find a family physician, where millions of Canadians don't have a family doctor. None of those problems get solved with a for-profit delivery. That's why we're saying, let's solve the problem. Let's actually give people what they need. Frontline healthcare workers, nurses, physicians, access to primary care, access to emergency care that doesn't take hours and hours. None of that is going to be solved by having a for-profit delivery of services. All that can be solved if we hire more healthcare workers. Let's do that.
That's all the
Thank
time
you.
we had. This brings the end to the press conference.
Merci.
Thank you.
Thank you so much. Merci. Hey,
Good job.
thanks so much.
Thank you.
Thank you. Really appreciate it.
Thanks so much.
Thank you. Really appreciate you being here. It means a lot. It's